Today is a very hard day for us because we have in the morning some missile attacks. It was very close to my house, and it was like so we got used to it now, but it is always very it is always very hard to be with it. So yeah, but everything is okay. I'm in my workplace and everything, we are alive, everything is okay, so thank you. And when I was in my last years of studying in my medical school, I was very interested in bioethics, because we have an opportunity in our medical school at the same time to work as nurses. And I was a nurse in the NICU department for newborns. And I was really struggled in different bioethical questions near this neonatal intensive care, and it was the first time when I was interested in bioethics, and in this reason I joined to the certificate program in Ukrainian Catholic University in School of Bioethics. And from this point, my road was started. We have a really pure education in bioethics in Ukraine. So this program, which I had in Ukrainian Catholic University, is maybe, I think it is unique in our country, but it is very it is very broad. We had some topics in this certificate program, like about transplantation, about some medical questions, about, for example, about abortion, about some reproductive technologies and all the things. But from my perspective, it is very little part of bioethics in medical field. Emily Anderson came to Ukraine in 2017, and she started the lectures about research ethics. And I was shocked. I was like the student in this program, and Emily was the professor. And she told us about research ethics, and I have questioned, what is it, how it works? And she told us about some policies, about some ethical questions which is raising during the research. And I questioned myself, what is research? Because I graduated medical school, and I had no idea how I can apply these knowledges which Emily gave us in my practice. And then I asked School of Bioethics, do you know any like facilities or any university or something like that when we can apply all these things Emily gave us? And they say maybe some national institutes or things like that, but we have no idea where some institutional review board exists. And I was shocked, because we are in the medicine, and now we use your research data from up to date, from Center of Control of Disease, from some like Cochrane library on all the things, but like 7 years ago, I even didn't know about research, and about research ethic, nothing. And we started to talk with Emily about this. And after maybe after 3 years, she came to us, And she said, oh, let's make some program between UCU and Loyola, which will give you, your university, and your students and your doctors, physicians, the opportunity to give more knowledge about ethics, not only research ethics, but about ethics. And I was at that time as a manager in School of Bioethics, and I started to establish institutional review board in Ukrainian Catholic University, because we had the Faculty of Healthcare Science. And I said, oh, we have biomedical research, and we have to, and our university need IRB. And in this point, I started to talk with Emily, and she said, oh, okay, it is a great idea. And at the same time, she said, oh, I have the opportunity to make some efforts to make this program between Loyola and UCU. And it was like a great merge. And she started to write the grant, and we started to organize all of this, because it lasted for, I guess, 1 year, because it is a huge amount of work. And at this reason, I came to US in the February 2020. My purpose was to gain more knowledge about institutional review board. And in the, I guess, in February 2020, Emily said that we received the grant from Fogarty. And she said, and the COVID pandemic was started. And she asked me, Yaryna, what do you think? What do we have to do? And I said, we have to move, because we have this approved, so we have to do this. And I became the manager, particularly of this collaboration of this program. I have like the dream to study in this program, but I understood that at first I have to manage this, and then maybe if we will have the students and we will start this, maybe then I will have the opportunity to be a student. So in 2020, we started this collaboration. It was very hard because the COVID pandemic, because we have to recruit a lot of students, and you know that everyone was struggled with this time. So but it was like the beginning of this program and the collaboration, and also my impact on this. So the Institutional Review Board in Ukrainian Catholic University was established last year on July, and we are starting the first review on this year. So it is, if I will say that 4 years ago it was like a dream, and now it is the reality. And now I'm in my independent study course, which helps me to make the operational procedures in IRB in Ukrainian Catholic University. So I started as a student this program last year on January, and the full-scale innovation was on February, and I didn't stop my studying process. And in one time, I recognized that to be part of this program is to be part of the normal life, to normal life without war, to normal people who live without missile attacks, without everyday stress. And when I participated with all Zoom sessions and lectures, it was like the it was like the feeling of the normal life without war. And till now, I'm really happy about this, because maybe it influenced me, my mental health also, because it's very hard to live always in this stress, and also it was a great opportunity to share our experience during this war, and to communicate with another students in this program, and to raise different ethical questions also in war ethics, in war healthcare ethics, you know. So it is very it was a great opportunity to be a part of normal life. I'm very thankful for this program and for this opportunity to be here, because it helped. Of course, I say use that that it is like the participation in normal life, but also it is a great opportunity to develop my skills, to develop my English, to develop my my manager skills and all the things. So I'm just very thankful for this. And yeah, and I plan to use all I gain from this program in my practice, in my daily life.